Do you know what is a HbA1c test? Why do we do this test? How do we do this test? Why this test is performed and where this test is conducted? What is the science behind this test and how do we interpret the results of the HbA1c test? If you have a diabetes, what should be your target HbA1c? If not, then stay tuned with me because we are going to discuss that in our today's topic. Namaste. My name is Dr. Tanvi Mayur Patel. I am an endocrinologist, hormone specialist doctor from Mumbai, India. Now, before I begin this video, one important information. If you want to watch this video in Hindi language, then on the I button and in the description box, there is a link. If you click on that link, this video will be played in Hindi language for you. अगर आप इस वीडियो को हिंदी भाषा में देखना चाहते हैं तो ऊपर आई बटन पे और नीचे डिस्क्रिप्शन बॉक्स में एक लिंक है। अगर आप उस लिंक पे क्लिक करेंगे तो इस वीडियो को आप हिंदी भाषा में पाएंगे। What is a HbA1c test? See, HbA1c test, it's a blood test. It is a test which indicates what was your blood sugar over the past 2 to 3 months. This test we basically use to diagnose whether you have a diabetes or not, and we also use it to monitor your treatment for the diabetes. In fact, HbA1c test is a very important test in all the international organizations of the diabetes, like WHO, World Health Organization, then IDF, International Diabetes Federation, American Diabetes Association like a ADA, and plenty many international associations pertaining to diabetes. All of that, they have given a lot of importance to HbA1c test in the monitoring of a diabetes. HbA1c test is also known by other names like glycosylated hemoglobin test, glycohemoglobin test, HbA1c test. These are just to name a few. HbA1c test, as I told you, that it gives you an average of the last 3 month blood sugar. Now let's see what is a rationale or a science behind this HbA1c test. See, whatever food we consume, that all has a carbohydrate, protein and fat. This gets broken down and gets digested. And after the digestion, the glucose from this food gets absorbed into our blood. So now in our blood, we have a glucose. That is the reason why we call it as a blood glucose. Okay. Now, our blood is a red in color. Now, the red color of the blood is because of the presence of a red blood cells, or we call it as a RBC. Now, this red blood cells has a very important component in itself, and that is a hemoglobin. This hemoglobin, the main job of it is to carry the oxygen to each and every cells of our body. This hemoglobin is made up of two components, heme and globin. So the heme part actually has the iron and the globin is the protein component. This globin protein has two chains, alpha chain and a beta chain. Okay. So now when there is a glucose inside our blood, this glucose binds with this beta chain. And when they bind with each other, there is a metabolic reaction which happens. And at the end of this metabolic reaction, we get a stable compound called as a ketoamine. Our HbA1c test has the ability to detect this stable compound. And that's the reason why it can help us in detecting the average blood sugar. Now, the lifespan of the RBC is a 120 days, and that is the reason why the average blood sugar what we get from the HbA1c test is that of a 120 days, or we call it as a 3 months. If there is a lot of blood sugar, then what will happen? More the blood sugar, more it will bind with the beta chain and we will get more ketoamine, and more the ketoamine, more will be the HbA1c. That means Higher the blood sugar, higher the percentage of the HbA1c. So that is how this test is interpreted and we get the result. Now let's see that where do we do this test. See, this test is ideally performed in the laboratory. However, now we do have a certain advanced equipments due to which we can also test this test at the doctor's office. So either you can get this test at the laboratory or at your doctor's office. Unfortunately, we don't have any home kit wherein you can get the HbA1c done at your home, and they are not actually that much reliable. So the technology what we use for interpretation of the HbA1c test is two technologies. The first is a HPLC or high pressure liquid chromatography, and the second technique is a immunoturbidimetric HbA1c assays. Both of these techniques are internationally accredited and are considered very reliable in interpreting the HbA1c test. Now, this test is not very expensive. Depending on your geographical location, the pricing vary. In India, this report can be done anywhere from 250 rupees to 600 rupees also. Now another question patient has, where do you get this test done? See, this test can be done either at two places. The first, you get this test done at the laboratory, and the second at your doctor's office. Now, so depending on where you are getting your test done, your results will come accordingly. So let's say that if you are getting this test done at the laboratory, in that case you will have to visit the laboratory. Now the phlebotomist over there will collect a small amount of a blood sample, anywhere between 1 to 3 ml of the blood. They will collect this blood sample from your vein, that is a venous blood sample is collected, and this is usually collected from your arm. And once the blood sample is collected, it is sent to the laboratory for the interpretation of your reports. So usually the reports arrive within 2 to 6 hours, that means within the same day the reports usually arrives. The second place where you can get the test done is at your doctor's office. So if you are going to get this test done at your doctor's office might have a new advanced small handy equipment which can detect the HbA1c test. Now in that case, your doctor might use a small pointed lancet and will prick your finger, and a small amount of a blood is collected. This blood is usually a capillary blood. Now this blood is then used for the interpretation of the HbA1c. At the doctor's office, you might get your results anywhere between 15 to 30 minutes of time. So that quickly is what you get your results. Many people have a question that can this test be used in a replacement of the conventional blood sugar test? Answer is no. See, many times many people have a habit of getting only HbA1c test done, and they don't do themselves a fasting blood sugar or a postprandial blood sugar or random blood sugar. Please don't make such mistake, because the HbA1c test gives us the average of a 3-month sugar. It does not give us the fluctuations of your blood sugars which happens every now and then. That can be picked up only by a fasting or a postprandial blood sugar. Many a times what happens, if you have gone out in a restaurant or in a party where you have had lot of food, your fasting and a post-meal blood sugar will change. But that cannot be detected by the HbA1c test. Similarly, there can be an incidence of a low blood sugar, which can be easily picked up by doing a random blood sugar, which will again not be picked up by the HbA1c. So both of these tests serve a different purpose. They should not be used in place of each other, but they should be used together for us to know the best outcome of your diabetes. There have been situations wherein we see two patients who have the same HbA1c result. The patient A will have a very stable blood sugar over the last 3 months. And then there can be a patient B who has a lot of fluctuations in blood sugar. So both of those patients need a different kind of a treatment. That can only be decided only when we do the conventional blood sugar test. So all these, the glycemic variability which cannot be detected by the HbA1c test, and that can be detected only by the conventional blood test. By the way, what is a glycemic variability? I have made a special video for that. You can watch that video so that you will get a more detailed information about it. Now let's see what should be your goal or a target for the HbA1c. See, the target of the HbA1c depends on many factors. What is your age? What kind of a diabetes do you have? Whether are you having a type 1 diabetes or a type 2 diabetes? What are the methods you are using for the control of your diabetes? Whether are you just doing a lifestyle modification, or you are taking an oral tablets, or you are on insulin. It also depends whether do you have any other health related problems, especially that of your heart, your kidney and your liver. So based on all these parameters, your doctor will decide the ideal target HbA1c for you. But on an average, for all the diabetic, the HbA1c target is set at around 7%. Most of the international guidelines also recommend that if we maintain your HbA1c target up to 7%, you have a less chances of getting into the complications. However, again, it depends on individual to individual. If you are a person who is a 65 or 70 years of age, it might be possible that a doctor will keep your HbA1c target relatively loose, and doctor might suggest a target of HbA1c 7 to 8%. The reason behind that is that usually at this age, duration of the diabetes also increases. At the same time, many a time such elderly population do not get a right warning of the symptoms of the low blood sugar. So we don't want any kind of a clinical hypoglycemic symptoms. So we tend to keep a target relatively higher. Also, if you develop into low blood sugar, it can trigger many other heart related ailments also. So that's the reason why for an elderly population, our target is relatively little lighter. But if you are a younger population, let's say your age of around 40, 45, then your target will be little tighter, because we don't want that if we keep your target loose, then you might have a higher chances of getting into complications at a very early age, and we don't want that. So to avoid that, we keep the HbA1c a little strict in your particular case. Also, if you are a type 1 diabetic, type 1 diabetic has a very common problem of going into repetitive hypoglycemia and a low blood sugar. So for type 1 diabetic also, we trying to keep a little loose HbA1c target so that we prevent such a hypoincidences. Alright, so whatever will be your target, you must discuss with your doctor, and your doctor will be able to suggest you. Now let's see what are the advantages of HbA1c test. See, HbA1c test has many advantages. The very first advantage is that you can get this test done any time of the day. You don't have to wait at specific time. At the same time, you can get the test done whether you are in a fasting state or whether you are into a post-meal state. So fasting is usually not recommended. Also, the other advantage is that you need to give your blood sample only one time. See, there are many other tests to detect the blood sugar, like we have a conventional oral glucose tolerance test, what we call it as a OGTT, wherein a person has to give a blood sample quite many times. Or also fasting blood sugar, postprandial blood sugar, you will have to prick yourself twice. But that doesn't happen with the HbA1c. You have to give your blood sample only once. So that makes it little easy for the person who is getting themselves tested. Also, the HbA1c test bypasses the interpersonal variability, and that's the reason why it is a more reliable method. HbA1c test is also used for the diagnosis of the diabetes. And if you have a diabetes, what is your treatment program, whether it is effective or not, whether we have to modify it, we can take all those decisions based on the HbA1c. Many times such decisions cannot be taken by just one time of fasting or a random blood sugar. Also, HbA1c test also gives us a indirect indications whether are you going to develop a future complications of the diabetes or not, and if yes, what all precautions we need to take so that we can protect you from such complications that we can do only because of the HbA1c test. Also, HbA1c bypasses many short-term fluctuations like that of a stress. So when you are under stress, your blood sugars will be high, but that can be bypassed when you do a HbA1c test. So HbA1c test is not affected by a short-term changes in your lifestyle. So that's the reason why this test becomes more reliable. And also the technique what we use for the HbA1c test, just like I told you, HPLC technique or immunoturbidimetric technique, these techniques are very reliable and accurate methods. And because this technique usage is a good, all the equipments which uses this technique are also more reliable, and that's the reason why HbA1c reports are relatively better interpreted compared to the other tests. In fact, in all the clinical trials, what doctors and the medical fraternity does, they use these techniques and these results for the interpretation of the reports of such a medical trials, and helps us in diagnosing and detecting the right kind of a treatment program for the people who have a diabetes. Another question people ask is that, is fasting needed for getting this test? Then answer is no, you don't need to be in a fasting state. You can get the test done at any time of the day. However, if you are doing certain other tests like that of a fasting blood sugar, or if you are getting yourself tested for the cholesterol, in that kind of a situation, of course, you will need to be in the fasting state. So you can use one blood sample to detect all of these blood tests also. So at that time, yes, you have to be in the fasting state. Another question patient usually ask is that, if I am going to give this sample, can the same sample be used for other testing? Answer is yes, the same blood sample can be used for many other tests, but again it depends on what technique is used. So you can speak to your phlebotomist and they will be able to guide you. Now let's see how HbA1c results are interpreted. See, HbA1c results are interpreted in percentage. Now, the HbA1c in a person who does not have a diabetes and who is very healthy will have anywhere between 4% to 5.6%. If you are on a verge of getting a diabetes, what we call it is a pre-diabetes, your HbA1c will be anywhere between 5.6 to 6.4%. And if you have a diabetes, then your HbA1c will be anywhere from 6.5% onwards. And if you have a diabetes which is not controlled over a period of time, you can have a HbA1c more than 8%. In ideal situation, the target of the HbA1c is given as 7% to all the diabetics, so that we can prevent the future coming complication. Now many people have a question, is HbA1c test same as that of a routine blood sugar test? Answer is no. See, HbA1c test gives us an average of a last 2 to 3 month blood sugar, whereas a routinely blood sugar done test like a fasting blood sugar or a postprandial blood sugar, those reports are indicating only for a time being. So both of these tests are completely different. However, we use both of them in your management of a diabetes. Now let's see why HbA1c test is done and what is the indications. So very first indication is to diagnose whether you have a pre-diabetes or not. So if you have any symptoms which suggest that of a diabetes, you might need to get this test done, and then this test will help you in diagnosing whether you have a pre-diabetes or not. Secondly, this test also gives us a reliable result for us to diagnose you whether you have a diabetes or not. So this test is used for the diagnosing of a diabetes. Now, if you already have a diabetes, then also we do this test very routinely in order to find out whether your diabetes is in the control range or not. The medications which you might be taking, are these medicines are actually having its work and they are actually being effective or not. This test will also indicate us that what is the treatment going on, whether do we need to change your medications or can we continue. This result also gives us a future indications that will you be developing a complications of a diabetes or not. So for all of these we do this test, and that is the main indication of doing the test. Now let's see whom all we recommend getting this test done. See, especially in a country like India, which is called as a diabetes capital in the world, it is very important for each and every individual should get themselves tested for the HbA1c at least once in a year. Now please understand, nearly 60% of the people who have a diabetes do not have any symptoms of the diabetes. So how do we detect this early diabetics? Unless and until we do the blood test, we don't have any other means. And due to the many advantages which HbA1c test bring it along, so it's important that we do this test at least once in a year to know whether you have a diabetes or not. Now, secondly, as per the guidelines, if your age is 45 years and above, you should getting considered doing this test at least once in a 2 to 3 years. Ideally, once in a year as per my clinical experience. Okay, and if your age is below 45 years of age and you have a risk factors of getting into a diabetes, then in that case you need to get this test every once in a year. Now, what are the risk factors? So if you have a family history who has a diabetes, if you are taking any medications like steroids, then if you are physically inactive and if your body weight is very high, if you have other health problems like that of a PCOS or a polycystic ovarian syndrome or a thyroid health problems, if you are into a lot of addictions like smoking and alcohol, if you are living a very stressful life, all of these are an indication and can be a risk factors for you to develop a early diabetes. In that situation, you should try and consider getting yourself tested more often. Also, if you are using medicines like an insulin or a oral hypoglycemic agents like sulfonylurea, you tend to have a hypoglycemic events. Again, in that case, your HbA1c target can be decided based on your treatment program. Alright. Now let's see what are the reasons or the causes of a high HbA1c. See, there can be many reasons why your HbA1c can be high. Let's take the first cause, and that is a newly detected diabetes. Yes, you never had a diabetes in the past, but you are developing symptoms of the diabetes and you did a blood test, and you will be shocked and surprised to see a HbA1c very high. In fact, in our clinical practice, we have seen newly detected diabetes going up to HbA1c of 16-17% also. So, newly detected uncontrolled diabetes is one of the very common reason of a high HbA1c. Second, if you have already diabetes and for some reason you are not following the treatment correctly, then also your HbA1c can be high. Third, if you are an obese person, then your HbA1c will be higher than compared to a non-obese person. See, when your body weight increases, the sensitivity of the insulin decreases and you tend to have a high insulin resistance, and this situation brings a higher HbA1c. Also, if you are physically inactive and you are very lazy kind of a person, your HbA1c will be higher than a person who is a very physically active. There is a special kind of a hormonal problem in a woman, what we call it as a PCOS or a polycystic ovarian syndrome. Such women also have a higher HbA1c. Also, if you are taking a certain medications like that of a steroid, your HbA1c will be relatively higher compared to the other population. Then there is one more hormonal problem called as a Cushing syndrome. So if you have a Cushing syndrome, you will have a higher HbA1c. Now what will happen if your HbA1c is high? See, more the HbA1c means higher is your average blood sugar, and higher the average blood sugar, you have a higher the chances of developing complications due to diabetes, like that of your eyes, your heart, your kidneys and your nerves. That's the reason why we always tell patients to keep their HbA1c in the controlled range. Now let's see, is there any limitations to this HbA1c test? See, usually HbA1c test is a very reliable and very accurate. However, these reports do have certain limitations. So the first limitation is the pregnancy. So if you are a pregnant woman, then there are a lot of hormonal changes which happens to your body, and many times HbA1c cannot be very correct and accurate. Second, if you have a recent blood transfusion, or if you have got a recent accident or a surgery or operation wherein you lost a lot of blood, again HbA1c can be misinterpreted. If you have developed any disease of a liver or a kidney, again HbA1c can be misinterpreted. If you have any blood related health issues like anemia, thalassemia, HbA1c has a limitation. See, there is a special kind of a diseases wherein you have a hemoglobin variants. Now, if you have such kind of a health problem, then in that case, HbA1c test may not be completely reliable in your case. So, you must speak to your doctor and inform your doctor about it, so your doctor can guide you alternative testing which can help you diagnosing whether you have a diabetes or not. And if you are a diabetic, it will also help you in monitoring your diabetes. Usually such hemoglobin variant problem happens more to the people who stay in the Africa or a Southeast Asian population and a Mediterranean population. So all these people have a limitations of the HbA1c test. Also, if you are taking a medications like a opioid, or if you are an HIV patient, then if you are taking an antiviral drugs for the treatment of the HIV/AIDS, then also HbA1c test can be misinterpreted. Now, there are many conditions where the HbA1c can also be misinterpreted, especially if you are consuming lot of alcohol, or if you have a very high level of a blood cholesterol, and if you are taking any medications for the vitamin B12 deficiencies, or if you have an imbalance of the vitamin C, vitamin E, all of that can falsely misinterpret the HbA1c. A common question patients also ask is, how often do you have to get these tests done? See, again it depends what is the type of a diabetes you have, what is the duration of a diabetes, what are the kind of a medications you are taking. If you don't have a diabetes but you are on the verge of a diabetes, that is a pre-diabetes, in that case you have to get yourself tested once in a year. If you have a type 1 diabetes, in that case every 3 months you should get your HbA1c tested. That means you will have to get this test minimum 3 to 4 times in a year. If you have a type 2 diabetes and you are on the treatment for that, and if your treatment is repetitively changed, or if your diabetes is not controlled properly, then again you should get this test done every 3 months. But let's say you have a type 2 diabetes and your diabetes is absolutely in control, then in that case you can do this test once in a 6 months, that means 2 times in a year. But again it depends on your type of a diabetes, so you please speak to your doctor and they will be able to guide you. Alright, so that's what we saw today about the diabetes HbA1c test. Have you done this test in the past? And if yes, what was your result? Please don't forget to write in the comment box. I hope after watching this video you got some good useful information. If you have any of your personal question pertaining to your health, please write that in the comment box. I will try to read them and answer them as early as I can. And if you are new to my channel and if you have not subscribed to my channel, please subscribe so that you will get more and more health related information. And then there is a bell icon. If you click there, as and when my new video will be published, you will get an instant notification. We will meet again in another video with some new information. Till then, take care of yourself. Namaste.